Somebody asked how I was able to retire in my 40s. I gave a rather detailed video response, and this person here said the following. Thank you for sharing. You're welcome. Going to order your book. If you want to order my book, I've written 2 books. This is the first book. It's the story of the first 45 years of my life. And they went on to say, do you cover what you did for health insurance? That is my biggest concern. Do not cover what we did for health insurance here, because this book goes to the age of 45 when I retired and my wife was still working. She's the one that encouraged me to retire. And she's the one who kept working after I retired up until this past year. The roles have since reversed. She's retired. I'm working again. When I retired, we were already under my wife's health insurance plan through her employer. And so that's how we continued our health insurance as long as she was working. And she worked for a few more years for that company. And then things fell apart and she switched companies, as I mentioned in the video. By the way, if you're on TikTok or YouTube, you can see that original video. It's out there for folks to see. But anyway, so we had employer provided health insurance, and then she switched jobs, and we took that employer provided health insurance, which, by the way, was worse than what we had before that, and it was dog shit insurance, in my opinion, or at least part of it was. Anyway, and so we continued to have employer provided health insurance up until May 31st of last year, 2024, which is when my wife's company collapsed. It folded. It went under. Then we were without health insurance. So we had to switch and go through the marketplace, through the Affordable Care Act, the dreaded Obamacare. And it helped. We currently pay for our health insurance out of pocket 100%. And let me tell you something, that ain't fun. In the United States of America, that is not fun. That is a hefty, hefty penny. But that's what we're doing. So because I work for myself and she's no longer working, and she hasn't worked since May 31st, the last day of May 2024. That's the last day she worked. Not that she hasn't looked for work. Her industry, there isn't a lot to be had, and probably not a bright future for that industry, considering her industry is the exporting of bulk agricultural commodities, specifically the exporting of bulk agricultural commodities to Southeast Asia. It's probably not going to have a bright future over the course of the next 4 to 5 years. Having said that, as I said, she's no longer working. We are sustaining entirely off of what I make via social media, predominantly YouTube. YouTube is what's paying the bills, and we pay for health insurance out of pocket. It sucks. It does. I'm not going to lie to you. The healthcare system, the healthcare delivery system. Now, healthcare delivery system would be, I guess, your doctors and your nurses. But when I say healthcare delivery system, I'm talking about our insurance system, how one gets covered for the care they get when they go to see the doctors and the nurses and the CNAs. That system, our healthcare system of insuring people, is the dumbest system on the planet. It's the dumbest fucking system on the planet. Every other industrialized nation has universal healthcare. We here in the United States of America, while puffing our chest out and talking about how star-spangled fucking better we are than everybody else, pays more for their health care and has worse outcomes. We have lower life expectancies. We pay more for our prescription medications. We pay more for our co-payments. We pay more to go to the hospital. It is the dumbest fucking system known to man. And why do we have this system? Well, because somebody's got to make money off your fucking ailment in this country.